So we're going to be talking to you about St. John's wort. St. John's wort is a plant that grows in the wild. It's most commonly used for mental health conditions. The scientific name is Hypericum perfatorum. It's most commonly used and prescribed in Europe for depression. It comes in an oral form and a topical form, and it's an over-the-counter medication. The oral form comes in like a capsule, liquid, or like a dried herb tea. It's used for depression, psychosomatic disorders, OCD, anxiety, premenstrual syndrome, burning mouth syndrome, neuropathy. And the topical form comes in an oil, and it's used for like atopic dermatitis and is helps with wound healing. The mechanism of action, so it has hypericin in it, which acts as an antibiotic or an antiviral. It also produces dopaminergic and selective serotonin reuptake inhibitor effects, which helps elevate someone's mood. And the topical form has like an antibacterial effect, and it increases epithelialization to help with wound healing. The standard dose for adults is 300 milligrams, and it's taken 3 times a day with a 0.3% of hypericin in it. It may be as effective as standard antidepressants to help elevate people's mood with mild to moderate depression with less side effects. It also may increase the rate of healing in second and third degree burns. These are the adverse effects that are listed. We found that SSRIs and St. John's wort used together can cause additive effects on serotonin reuptake inhibition, which could lead to serotonin syndrome, which is like a bunch of symptoms due to excessive serotonin, such as agitation, restlessness, and confusion, rapid heart rate, high blood pressure, and the rest of the symptoms are listed here. Some warnings, so contraindications, so you should not use if you're pregnant, if you have a hypersensitivity to hypericum, Alzheimer's disease, bipolar disorder, psychosis, schizophrenia. You should avoid strong sunlight, and it's also an inducer of the enzyme CYP3A4, which reduces the efficacy of a lot of medications. It's an important enzyme in the body that's found in the liver and the intestine, and it oxidizes toxins or drugs so that they can be removed from the body. You want to avoid tyramine-containing foods. Oral anticoagulants, especially warfarin, should not be used with hypericum, or these should not be used when taking St. John's wort. It decreases the warfarin's effect. Other information that I found that it should not be used for more than 8 weeks, and you should avoid abrupt discontinuation due to withdrawal symptoms. And it can weaken many prescription medications, which are listed on the slide.
So, as far as evidence for its efficacy and how St. John's wort actually works, there's mixed results. This first study was a systematic review looking at the effects of St. John's wort for major depression. They looked at 35 studies who met their inclusion criteria, and their conclusions were it was superior to using a placebo to improve depression symptoms for mild to moderate depression, but it really wasn't significantly different than your typical antidepressants like SSRIs or tricyclics. And they did find that more information was still needed to get a real definitive answer on that one. This next one was a review looking at some of the adverse effects and some of the uses and drug interactions with St. John's wort. Like we said before, St. John's wort is a cytochrome P450 inducer, which actually can increase the metabolism of a lot of prescription drugs and other pharmaceutical supplements that you may be taking. The conclusion of this study did say that it was a safe alternative for depression and free of cardiac side effects that are seen with typical medications used for depression. And then we also found one more study that looked at how it induces other pharmaceuticals like warfarin specifically. They had subjects that were pre-treated with St. John's wort for about 2 weeks, and then they were given 25 milligrams of warfarin, and then St. John's wort again for another 7 days after the supplementation with warfarin, and they found that St. John's wort significantly induced the elimination of warfarin, limiting its effects. So, as far as our recommendations go, the evidence is mixed on St. John's wort. It may reduce depressive symptoms, but the potency of it is not significantly better than SSRIs or tricyclics, which are your typical depressive medications. But if you're a healthy individual with no contraindications, you're not on a lot of other medications, it may be something that you could look into taking, but I would just say be cautious and make sure you talk to your primary care physician first.